One of the challenges that we're faced with, I'm sure across the nation, but specifically in Oklahoma, is the number of providers that will take Medicare. In Oklahoma, the Oklahoma Allergy and Asthma Clinic, as well as the Allergy Clinic in Tulsa, are the only two allergy clinics in Oklahoma that takes Medicare. That is staggering whenever you look at the rural areas. We get patients from Kansas, western side of Oklahoma, as well as New Mexico coming to visit us because there's no one else to take Medicare. With the challenge of reimbursements and overhead, we have to find unique challenges that will allow us to see these patients and at the same time cover overhead. With the onset or the potential of Medicare reducing their fee schedule, coupled with the fact that we're looking at implementing electronic health records as mandated by Medicare, we're having several challenges. When I met with the board about 2 months ago over the impact of these two situations, the first question was, what would happen if we just did not see Medicare? And that was a situation I didn't want to address, because I think we need to see Medicare, we need to continue seeing Medicare, and we just need to be working a little smarter and making sure our patient population is taken care of. With the Medicare reimbursements fluctuating, a lot of insurance carriers, a lot of commercial insurance carriers also fluctuate their payments based on what Medicare does. If Medicare drops their payments by 3%, 5%, 10%, they decrease theirs as well. If Medicare increases it, the commercial carriers increase theirs as well. I'm in the process right now to determine if Medicare drops their reimbursement by, let's say, 5%, what kind of ripple effect would that have across the board with our other commercial insurance? And it is staggering on how much we're going to be losing as far as revenue. One of the other issues with the Medicare is encouraging people or other practitioners to take Medicare. And as we have the challenge of having less reimbursement and more mandates, there's less and less providers signing on for Medicare. I have talked to some of my constituents in Oklahoma, some of the CEOs and administrators, asked them what they were going to do, and they said they were going to, basically if Medicare drops their reimbursements, they're just going to drop Medicare. They said they cannot survive. Because 2 years ago, I had two sole practitioners see Medicare and Medicaid trying to build a practice. They had one staff member, and they gave up. They went on to something, back to teaching at a university because it failed, because of the reimbursements they were trying to do, and plus the dollars that they were expending trying to deal with Medicare. And at Oklahoma Allergy and Asthma Clinic, I have 2 members solely devoted to Medicare. And all the other insurance carriers only have 4. So that's a big impact on how we see patients and what some of the challenges we're faced with.